Wellness. Our society spends much time and energy trying to achieve it. Exercising, eating right, and taking vitamins, all to help ensure a longer, healthier life. Meanwhile, millions of women in America from puberty to age 50 are suffering with problems related to sex hormones. Sex hormones influence much more than libido. They can lead to a broad range of severe, even disabling symptoms and serious health issues. Look and listen to these common examples of sex hormone-related syndromes and see if they apply to you. Your desire for sex has dramatically diminished since starting oral contraceptives. You are experiencing partial or complete lack of response to treatments for anxiety and/or depression. You are experiencing unpredictable mood swings, irregular periods, sweats, sexual problems, and fatigue since starting progesterone-only contraception. You are plagued with migraines and/or mood swings that occur monthly around the time of your cycle. You are fatigued, losing muscle tone, gaining central fat, even though your diet and exercise have been maintained. Unaware of the cause or that there is effective treatment available, most women needlessly suffer with these conditions. Extensive medical research has shown that sex hormones play a significant role in a person's overall health, quality of life, and life expectancy.
It is obvious to me that this is a very difficult area for women to get the care they need, at least within the context of the way medicine is right now. With these particular type of symptoms, almost universally, they express frustration. Often they've delayed coming to see me because they've even been made to wonder whether they even have a medical problem that can be treated. Often they feel like that people's suspicion that they really don't have symptoms, or they're just trying to get treatment that they really don't need. It is difficult enough for them that many patients, when they realize that I believe them and take them seriously and that there's treatment, cry openly. There's not a lack of evidence that sex hormones affect these symptoms. The problem is more a lack of support and training about what do we do if people come to us with these symptoms.
After years of sex hormone-related work as a clinician, researcher, and educator, in 2007, Dr. Jeffrey DeWester established the Gerald M. DeWester Treatment and Research Center, uniquely focused on research and treatment of men and women with complex sex hormone-related symptoms.
Our mission is to bring the principles of excellent medical science to bear on patients who are suffering from problems related to sex hormones. For me, that means applying what I learned from my father. He was exemplary of the best of what it means to be a physician. And so we want to demonstrate in how we care for these patients the same kind of devotion and concern, dedication to science, but also compassion as well that permeated his work with people. There are some patients that benefit for certain types of therapy. Migraine patients and patients with mood issues related to sex hormone. In those patients, smoothness of delivery and smoothness of the level of hormone is extremely important. The reason we got involved in pellet delivery is because it delivers that, and it does so independent pretty much of patient compliance. In fact, compliance actually is the biggest reason that treatment doesn't deliver the smooth levels that it should in patients with sex hormone problems.
More common examples of sex hormone-related syndromes. You have noticed being less motivated, less assertive, less productive, and more irritable at home and at work. You initiate sex less, are less uninhibited when you do so, and orgasm with less intensity and frequency. You are having increasing problems with vaginal dryness, poor lubrication, feeling warmer, and sleep disturbance since starting low-dose estrogen contraception. You are experiencing any of these and were told by your physician that it wasn't related to your sex hormone. The skilled, compassionate staff at the DeWester Treatment and Research Center has unmatched experience in treating these deficiencies, as well as syndromes caused or triggered by sex hormones.
This has been very rewarding work. We have patients who've come where their sexual issues have become a problem in their marriage, that even severely so, who now, not only is sex doing better, but their marriage in general is much better. We have patients who are debilitated by their mood disorder, unable to find treatment that gave them a complete response, migraines that are doing better and that they couldn't get fixed or wouldn't respond to other typical, very effective treatment. So we're seeing a lot of success, and we're very excited about it. Seeing people transform like that makes all the work really worthwhile. The average patient here probably sends us 2 or 3 other patients within 6 months, and I think that speaks very highly for itself.
After the birth of my daughter about 11 years ago, I was experiencing what I thought to be postpartum depression, so I came in to discuss that with Dr. DeWester, and we did some hormone testing and found out that my hormones were askew, and so we started hormone replacement therapy. Within the first couple of months of treatment, I started to feel quite a bit better.
A recognized leader in the understanding of complex medical conditions complicated by sex hormone deficiencies, Dr. DeWester actively teaches his theories and practices to other physicians.
Of all the areas I've taught in, there is no area where the need is greater and where I feel like I can do the most good as far as the demand out there, the patients who need help. So any patient, any physician that changes their views and becomes more effective, I know I'm affecting a lot of people. And I think education can go a long way here, but also it's going to take some changes in the way that medicine is occurring now. There's going to have to be more time to spend with patients if a lot of doctors are going to get involved more than they are today.
I didn't want to just be diagnosed and put on a pill to fix it. I wanted to know what my problem was, the underlying cause of it. I would recommend Dr. DeWester and his treatment to anybody.
As an educator, obviously I'm very excited that there is more discussion out there about sex hormones. And there's a lot of people now, comparatively speaking, trying to deal with it. On the other hand, there's certainly some problems with the current situation. There's a lot of people that are involved that may not have the training they need in some cases. And in a lot of centers, they don't devote the kind of time I think you need to devote with syndromes that are this complex. Having said that, overall I think the changes are positive and that we're moving in a good direction. We have a list of things we list that are commonly what we see, we talked about earlier. My message is if you have these things and you haven't gotten help before, there is help for you. Do not accept feeling miserable.
Effective treatment for sex hormone deficiency does exist. Learn more about the DeWester Treatment and Research Center today, applying excellence in medical science to your healthcare needs. For more information, go to drdewester.com or call the number on your screen.